right, hello everybody. We are going to do a total knee arthroplasty demonstration on patients of Dr. Wasser for nursing, specifically therapists if they need to look at it, getting in and out of the bed, positioning, precautions, all that good stuff. So our patient has a fake knee on the right. We are going to work on first rolling and getting out of bed. Okay, so I would use the actual railing for the patient if they're strong enough to hold on to it. So I'll go ahead and grab the railing there, and then I would use one hand possibly and another hand underneath the other knee after you've moved the painful knee close to you. Okay, now we're just going to roll to your side and sit up. Now, that's a quick demonstration. There's going to be pain, there's going to be some yelling, and that's okay. But that's about the easiest way to do it. Let's go over that again. Okay, their assistance on whatever rail is available, half rail. Move the painful leg closest to you, but not off the bed, because any little movement down will hurt. Some sort of hand assess, or even elbow if need be, and then the other leg. Roll and sit up. Okay, sitting on the edge of the bed, give them time. They're going to feel dizzy, nauseous, pain. Okay, the feet should be able to touch the floor. So help them slide out. Now what I call it is the one bun scooch. So I'll have them take that painful leg, get underneath, and just have them slide out one butt at a time until both feet are on the floor. Let them sit there for a little bit. We're actually going to do this with nursing most likely the afternoon of getting the patients out of surgery. Therapy is going to try to be there every day after they get out of surgery. After about 4 to 6 hours, they're going to stabilize. We're going to come up and hopefully with nursing assistant or the nurse, we'll do this with you. Now, if they feel good, they don't throw up, they feel like they can stand up, then we're going to go ahead and apply the gait belt. I would apply the gait belt on 100% of these patients. If it's not in here, I would go get one. They're going to feel lightheaded, nauseous, weak, and then when that pain, if they have pain and the numbness doesn't really help the knee, when that pain hits, they might feel like they're going to go down. And so you want to have the gait belt on them. It's just an easier way to save them. Always have a front wheel walker in the room, or whatever they bring you. I told Heather to kind of film the chair here. If you look, it's those big chairs. We want the big chairs in with all of our joint replacements, because a lot of times we're going to exercise in those chairs. When they sit up, that way they can prop their whole leg up. If it's down in a dependent position for too long through the day, it's just going to swell and be really painful. So we want these chairs that can recline back, and then just put pillows in them to make the patient as comfortable as possible. Okay? So the patient has to use the bed for transfers. They need to learn right away on how to push with their arms, and they're going to have to use their arms a lot more anyway, so they just need to make them stronger by using them on transfers. This leg should be out. The right leg is the total knee leg. Should be out just a little bit so it doesn't get a lot of the pressure. The left leg needs to be back and underneath. We're going to put all the pressure through the left leg and the arms on the bed. The right leg's just going to come along for the ride. Okay? I know that a lot of people like going through the armpit. Just make sure that you're not latched onto the armpit. Please go down to the gait belt if you want to use the arm. Otherwise, gait belt and then whatever guarding you need, have them shift their weight forward over their toes and then push on up. Okay, grab the walker. Okay, you can have the feet on the ground. Their weight bearing is tolerated, but it's not going to accept a lot of weight. In this position here, we need to take a look at their eyes, make sure that they're not going goofy on us, see how well they're supporting their weight through their arms. The walker should be at least hip height. Okay, those bony hips that stick out, the walker should be at least at that height with a little bit of arm bend. If you guys are getting them up, if they had surgery from like 3 to 6 in the afternoon and it's 9 o'clock at night, a lot of times I'm going to be in bed. So you guys might have to sit them up on the edge of the bed and actually stand them for the first time without therapy being there. Not a big deal. It should be just standard after we do enough of these. He said that he's only going to do surgeries in the morning to start with. We'll just see how it goes for a while. But after you've been exposed to this time and time again, this will just be standard. You won't even need the therapist a lot of times to get them up on the first effort. But we'll be there for the first couple months. So anyway, I got the gait belt applied. I'm kind of on the side that they might have the most trouble with, okay? And then they have the walker. Now, in order to move, we want to move the walker first, the surgery leg first as well. We're going to step into the walker, and then we're going to put all the weight through our arms and take one step to the leg. Okay? Step to the surgery leg. Walker, surgery leg, step 2. And we don't get them too close to the front of the walker, otherwise they could tip forward. And we don't want the walker too far in front, otherwise they can't put any weight to it. Step 2, the surgery leg. It's called step 2 gait. All the way to the chair. I just hold the gait belt, turn around in place. Do not have them pivot on the surgery leg. Have them pivot on this leg. Back up. Same thing, now we move the non-surgical leg first to go backwards. Non-surgical leg to go first backwards. Bring the walker to you, backwards till the leg hits the chair. Put this leg out in front so it doesn't take a lot of the weight. Okay, this is going to be our primary arm. We're going to reach back for the chair, and then the other arm, and then we're just going to slowly lower them down. Hardest part to do, get them in and out of the chair the first couple of days. So if you don't feel real comfortable with getting them all the way to the chair and back, dangle on the side of the bed and then back into bed. On that first day we should be there as long as the surgeries are in the morning. If there happens to be some special case and it's in the evenings, wait until the next morning. If you're uncomfortable, we'll come up and get them up that morning. Okay? Can you think of anything that we didn't cover that you guys would have questions about? Rolling, moving to the side of the bed with the leg. Okay, here's one that you guys might have questions on. What if they have a left total knee and they're sitting in this type of room? Still bring them this direction, okay? So let's do that. Let's go back into bed. Lay on down. We're switching the total knees. I'm just going to leave the gait belt on so you guys know to apply that. I don't like to get them up on the cluttered side. There's not enough space over there. This is the open area. I get as uncluttered as possible over here. Moving the chair over there is just not a good idea. And walking them, that entire space around, if you get them up on that side, is risky. They get tired fast, they might get too much pain, and they might just sit down on you. So you can still do it in this sense. It's just not going to look exactly as smooth as the other side did, because you've got to help this leg, and it's not going to bend like the non-surgical leg, okay? But we're still going to do the roll to the side. Okay, arm here, bring this leg over towards me, okay? I'm going to actually help this leg as much as possible now, okay? I might not even help her with her arms. I'm just going to have you kind of roll over, and you're going to help yourself, okay? Roll to your side, and come on up. Slide all the way out, one bum scooch, and down. That leg is not going to want to bend, and it's going to be sore. So if the leg is on the opposite side of the bed, you're going to have to support that leg. And what I can tell you, if they're big, is I would just bring 2 nurses to do it. If the therapist and a nurse is in here, then that's enough. Because what you could do is just have one person up on the upper body and one person solely helping the total knee out of the bed if they have to come all the way across. It should be pretty easy if that total knee is close to you, but you'll just have to see how it goes. There's no precautions other than just be careful with bending the knee too much and how much weight they put on it. It's going to be kind of numb, sore. You don't put all the weight, so that's why that step 2 gait. We step into it, and then we just go with that one step until they get used to it and until we're progressing in the hallway and you see us walking with them more steady. And that's another thing we want to talk about. They may not be able to make it into the bathroom, so bedside commode might be used that first night. But we need to try to make that determination in those first couple of hours that we get them up. 4 to 6 hours after they get back into the room before therapy goes home for the night. Okay, so it doesn't matter what bed you put them in, but if that knee is closest to the chair, it might be a little easier. And then when you do transfer them, just help that leg as much as possible those first couple of days because it will be sore. Oh, one thing with bed positioning. This is important. The head can come up as high as they want it to, but in these first couple of days, extension or straightening is very important. So no making them comfortable with the little bit of bend in the bed. Go ahead and crown up there. It needs to be completely straight and locked out. If they get used to having their knee bent, then it contractures right off the bat in like the first 48 hours, and it's really hard to help them. That's why we also need to have the chair, because we do want them up in the chair 2-3 times a day. We want this chair with the pillow prop. Throw me the pillow underneath your head there. So that it's straight. None of this. Feels great, but causes problems. So pain meds and therapy will help you with this, but this is how we want the leg position. Straight. Okay. Find therapy if you have any questions.